Hello everyone, good evening. Today I am going to tell you what is frozen embryo transfer, why is it carried out and what are its advantages. Frozen embryo transfer is a procedure where the embryos which are formed out of your IVF cycle are cryopreserved, that is preserved at a temperature of minus 196 degrees Celsius, that is in a liquid nitrogen surrounding, and these embryos which are cryopreserved, which are also known as frozen embryos, are transferred at a later date in the next cycle into your uterus, which is hormonally prepared after having undergone a process of thawing. The success rate for frozen and thawed embryo transfer cycles are generally about 5 to 10% higher than in the index cycle or autologous cycle transfer, because one can match the window of implantation more precisely in a frozen embryo transfer cycles. Besides that, there are certain distinct advantages of frozen embryo transfer cycles, such as in a patient where there is a possibility of a complication like ovarian hyperstimulation syndrome, which can happen if the embryos are transferred in the stimulation cycle. Once we do not transfer the embryos and freeze the embryos, the chances of ovarian hyperstimulation syndrome are brought down to zero. Also, when in the stimulation cycle the endometrium lining is imperfect, that is non-receptive, the embryos are cryopreserved to be transferred at a later date. Another reason for selecting frozen embryo transfer cycle is when the embryos are to be tested for genetic normalcy by a technique called as pre-implantation genetic testing for aneuploidy, which we do at our center for repeated IVF failures or patients who succeed with IVF but repeatedly miscarry. These are the patients where we advocate frozen embryo transfer cycles. So all in all, the success rate for frozen embryo transfer cycle for women under the age of 35 are around 60%. For women above the age of 40, however, they narrow down to around 18 to 20%. Thank you very much for watching the video.